everyone, it's Nicole from the Physio crew. In this Ask Nicole question, I'll just quickly read it. What is the best way to loosen up a stiff elbow following wearing a sling following a humeral fracture? So you may have heard the physios going on and on about you following hospital, that once you go into a sling, we still, depending on the type of injury that you've had, we want to make sure that any other areas don't get too stiff. So you must always take the advice of the physio or the doctor that gave you the advice right at the beginning, because myself, nobody else apart from someone who has your documentation is going to know what you're allowed and not allowed to do. Everybody is individual. So this is for information purposes only, and to give you kind of an idea of what I'd expect for a normal humeral fracture. I say a normal humeral fracture, there's lots of different, it could be a mid-shaft, you could have it sort of in the long bone, part of the bone. Humerus is this bone here, and you can get fractures of the humeral, there's a tubercle, so a bony prominence on the top of the shoulder, that can often have fractures. That's associated quite frequently with rotator cuff tears, or associated if you have a dislocation. Very, very common to get some associated trauma around that area as well. So really, as physios, what we're trying to do is prevent secondary problems. So that's things like a frozen shoulder. So a frozen shoulder is where the joint capsule itself gets tight. It's a condition that unfortunately can last up to about 18 months to 2 years. So we want to avoid getting these secondary problems of stiffness in the wrist, stiffness in the elbow, if you have had a fracture in the arm. So when they initially look at a fracture, they're going to try and stabilise it. So they're going to reduce it first of all, so they want to get the two ends of the bone as nice and neatly in line as possible. If you move a fracture too quickly, too soon, then you're not going to get the healing that you need. So in the beginning, in that first 6 weeks when you have a fracture, they're going to try and protect that area. There are ways that we can still move the hand and the wrist, even if you're in a sling, because they don't want you to move the humerus. You can still do exercises as long as you haven't got any associated fractures further down. So follow the advice that you've been given. Normally they'll give you a protocol, so it will allow you to know what to do at what stage. But certainly moving your hand is very important to keep the circulation flowing. Doing things like supination and pronation is very important, but you can do all of that with your hand and elbow close into your side, so that you're not moving the shoulder, you're not going to cause too much pressure on that area. Certain things will allow you to do take your arm out of the sling for certain periods of time, but again, that should be based on individual protocols depending on the type of fracture that you've had. After the 6 weeks, sometimes they'll still ask you to stay in the sling, but they'll ask you to take it out and do more exercises. It is important that we don't allow that elbow to get stiff. If you find it's getting stiff and you're feeling a bit stuck and you're not sure what to do, you can either go back to the consultant and ask the consultant in fracture clinic, or better probably just to see if you can get hold of your local physio, who will be able to guide you with that as well. Things that we want to make sure of if you have a fracture in your humerus, which is this bone here, is making sure that your circulation is normal, making sure that you can feel your hand. So sometimes with certain types of fractures, the circulation will be affected. So that's why doing things like moving your hand is really good, because you're pumping blood down. So the way that healing works is we release chemicals, and that's why we get swelling. So although everybody says, oh, we don't want to have swelling, swelling is actually the byproduct of healing. So it means that healing is occurring. We just don't want too much of it. To ship that, all the stuff that we don't want out, the swelling, we need circulation. So all of those things are moved within our inner body, so they can be moved within the blood and the lymphatic system as well. So actually moving your hand by doing sort of exercises like so, that can be very good at increasing the circulation. We want to make sure that we're not getting excessive wasting as well. So if we don't move, then we're going to get wasting of those muscles. So any muscles that are okay to move, we want to make sure we're keeping those strong. So yeah, I hope that's answered your question about how to keep it moving. I think the second part of that question, I'm not sure if I put it on the Facebook, but you had asked, should exercise be pain-free? Now, exercises are rarely pain-free, and it really depends on the type of structure and how long it is from you having a trauma. If you had an accident 6 months ago and you're getting pain with the exercises, it's unlikely that you're causing damage or harm. You might be irritating it, so we might want to avoid the aggravating factors, but we need to get you used to doing things. What people often do is when they get pain, they avoid doing any of the painful activities, but you've got to get used to those. So for example, if you have back pain, yes, in the first 2 weeks you might not want to be pushing yourself to put on socks and shoes and be aggressive. You may want to choose more gentle exercises, but eventually we've got to get you back to normal life. So we've got to do it in a very graded way, step by step, getting you used to work again, getting you used to your hobbies again. And so physio has a role in helping you get back to normal things in a graded way. Anyway, hope that helps you guys. Take care. Bye bye.